Hello, my name is Jorge, and I'm a biomedical engineering PhD student at the University of Minnesota in the Visible Heart Lab. The abstract I'm presenting is a novel transcatheter edge-to-edge suturing technique and prototype for repairing tricuspid valve regurgitation. The main problem that we are addressing in this study is tricuspid valve regurgitation. This is an increasing prevalent disease where the tricuspid valve leaflets fail to coapt or fully close together, which results in regurgitant blood flow. There are surgical repairs for this disease, which involves stitching together the leaflets to allow them to fully close, as shown in the top right image, and these are termed as edge-to-edge or Alfreer stitch repairs. Although these surgical repairs are established and effective, there is an increasing need to address the growing population of patients that are considered a high risk of mortality for conventional open heart surgery. They require minimally invasive procedures to perform the same repair. This need for percutaneous solutions is evident with the current field of transcatheter technologies and development that plicate leaflets. An example is shown in the bottom image where a metallic clip is implanted to grasp leaflets together. However, there are current issues and limitations with these systems. Specifically, they are exclusive to the mitral valve and are being translated to the right side of the heart. They are within early clinical studies, are highly specific, expensive, and require extensive training. These limitations could mean that these devices are not available for the current clinical centers and patient populations that need an immediate solution. Thus, for this study, we wanted to develop and test a novel technique to percutaneously enhance leaflet coaptation using ready-made and practical solutions. So for our solution to this, we took inspiration from other catheter-based suturing and electrosurgery techniques that utilize simple catheters, radiofrequency guide wires, and sutures to either puncture through cardiac tissue or vessels. For this study, we developed a catheter-based workflow designed to create an edge-to-edge repair by stitching together two tricuspid leaflets using commercially available or common catheters and surgical equipment. Our procedure currently requires only the equipment shown here, including two articulating catheters, guide wire, a loop snare and sheath, surgical suture, and endoscopic scissors. The bottom image highlights the steps for this procedure performed on reanimated swine hearts using visible heart methodologies. Every step was directly visualized and evaluated using endoscopic cameras. So as a general overview of the steps, it requires puncturing through the underside of the first leaflet with the guide wire, using snare retrieval to exchange it with a suture, and repeating this for the second leaflet as panels 1 through 6 are highlighting. Afterwards, the suture is now looped across the two leaflets, and a self-tying arbor knot is created to plicate the leaflets together. Lastly, the excess suture is removed with the endoscopic scissors as shown in panels 7 through 9. Most importantly, all these steps are done intracardiac using only one access port on the heart's superior vena cava to directly reach the tricuspid valve. And our results were positive. We successfully performed this procedure on 3 reanimated swine hearts to create a double orifice tricuspid valve as shown by the dissection images on the top right, where the suture remains secure and grasps the tricuspid leaflets together. Additionally, we replicated these steps on static perfusion fixed human hearts, as seen in the bottom image here, to see if they can be translated to human valvular tissue, and we achieved similar results. For continuation studies, we will continue to develop this technique to improve its feasibility. Furthermore, we can use this functional swine hearts where we induce tricuspid regurgitation, either by cutting chordae tendineae or causing pulmonary hypertension, and then quantifying the amount of regurgitation before and after creating this repair. Overall, this solution seems effective in performing an edge-to-edge repair on the tricuspid valve, and compared to other transcatheter repair systems that are currently unavailable, this catheter suture-based technique is simple, inexpensive, and ready to use with available catheter equipment. Thank you, and feel free to email us regarding questions and comments.